uses drugs. I'm going to tell you a little bit about my story, and then I'm going to tell you a little bit about the work that I do at the Overdose Prevention Site at St. Stephen's Community House. In 2014, I was diagnosed with hepatitis C, and I thought this was about the worst thing that could ever happen to me. But it turned out to be the best thing that ever happened to me, because I was referred to South Riverdale Community Health Center, where I was put through treatment, and well, I went through treatment, and I was introduced to harm reduction principles and the harm reduction community at large. And as a result of that, I changed the way I thought about drugs, and I changed the way I thought about myself. And I realized that even though there was a time in my life I thought it would never work again due to my mental illness and my addiction issues, that I could stand up and be a productive member of society and do meaningful work. And it is so rewarding to do the work that I do at St. Stephen's Community Health. St. Stephen's Community House, not Community Health Center. Get the next up. I'm far from perfect, but each day I do this work speaks to the value of harm reduction principles and the support that the harm reduction community can provide. We were one of 2 OPSs that Premier Ford and Minister Elliott cut funding to, and they didn't really give us any justification for this. And the good thing about this was that the community rallied around us, and we got donations, and I'm so grateful for these donations that have kept us open. And, you know, we are allowed to do great work at our Overdose Prevention Site. It's not just about reversing overdoses. We connect with our clients, and as a result of this, we can refer them to the services that they need to be healthy and have a sense of well-being and dignity. We make referrals to detoxes, to doctors, to methadone clinics, to shelters, to housing workers. And we see, sometimes very slowly, sometimes quicker than others, we see people stand up and be members of the community. And we have a lower number of overdoses at our site, but because of the naloxone that we have distributed in the community, well, actually, the reason why we have lower overdoses is because we take the time to connect with our clients and teach them how to prevent overdoses through using slowly and in our safe environment. And we've also distributed naloxone in the community, and we hear time and time again that these naloxone kits are used to save lives in the community. And that's very rewarding, because we provided our participants with education on how to use them properly. There have been other successes. We see our participants looking out for each other's welfare and supporting each other, and it's not just us doing it. And we see people getting enrolled in our peer education program, which has opened up job opportunities for them that may not have been available to them before. If people want to change their substance use pattern, we are there to support them. And all the way from moving from chaotic to problematic to recreational and to abstinence. Everyone who walks into our OPS, I hope, is treated with dignity and respect. And that is far different from what they face with the stigma around drug use at the community at large. Because we are surviving on private donations, our funding is insecure. This situation is stressful to our staff and to our participants alike. Many have come to rely on our services and the unique community that we created in Kensington Market for the well-being of our small community and for the Kensington Market community at large. We must secure stable funding. Thank you very much.